Today I will tell you about another substance that you hear the most about in aesthetics, fillers. Fillers have recently caused considerable reductions in aesthetic surgeries. In the past, we evaluated aging only with the presence of wrinkles on the face. However, the main thing in old age is the resorption and displacement of tissues that we call soft tissue in important parts of the face, namely fats. When do you see a full face? When you look at the faces of young people, but say a sunken face when you look at the faces of the elderly. There are many reasons for this. One of the most important is the resorption of the soft tissue fats, especially under the eyes and in the front of the cheeks, and the appearance of some pits here. These pits also cause under eye bags to become more prominent and give the person a sick or depressed impression. So, how do we fix this? The easiest way is to fill this place with any filler and restore it to its former fullness. Currently, there are fillers under various names that are produced in factories and sold ready to be given by injectors. Some of these fillers are made by imitating the real body tissues in the body at the factory, and some are made up of completely synthetic materials. I will not go into the names of the fillers made by imitating the tissues in the body. There is no need for such details. They generally have a temporary effect, such as 6 months or a year at most. However, fillings made of synthetic materials are completely permanent. But being persistent is not always good. If an undesirable result has occurred, it means that a permanent filler material will continue to be problematic forever. There is a second option for filling. It's a substance that has never been produced in factories but is abundant in all of us, our own fat tissues. Recently, the whole world has discovered the beneficial effect of adipose tissue when injected on the body. Personally, I prefer the filling made with the materials taken from the patient's own rather than the materials on the market produced in factories. The most common tissue taken from the patients themselves is the adipose tissue. However, tissues like muscle and fascia can also be used as fillers, such as some other tissues like dermis or parts removed for disposal after being ablated in an operation. So, how to get these tissues? Of course, it has to be taken from the body. Since removing any tissue from the body causes some pain, these are usually done in the operating room and after a certain numbing. This numbing can be done by locally anesthetizing the area with an injector or in the form of making the patient semi-drowsy with some intravenous sedatives, or it can be done under general anesthesia. I have said that the main harvested tissue is adipose tissue. Where do we get the fat? We get it from our body parts, our abdomen, waist, sometimes the inside of our legs, sometimes the inside of our knees. But even from the thinnest people, we can get enough fat to work for us if we put a little effort into it. So, what are the advantages and disadvantages of fat injection compared to fillers? Of course, with ready-made fillers, there is no need for an operating room or a painful tissue harvester. You lay the patient on the examination bed into the areas where you want to fill, for example, under the eyes or crow's feet, or the wrinkles on the side of the lip, or the areas where you want the lip to be thickened. Inject tiny drops of fillers and instantly get the result you want. The person who is injected gets up and goes on with his normal life. In fat filling, first this fat must be taken. Harvesting this fat somehow requires operating room conditions. Then the fat is made ready to be injected into the body. This is a medical procedure that we perform, and it takes 15 to 20 minutes at most. This can be done easily while the patient is at the table. Then, with special injectors and not needles, but some special round-ended pipes, which we call cannulas. Fats are given to the places needed by entering them through tiny holes. Where are these needed places? Deep pits under the eyes, deep pits just in front of the cheeks, the lines which we call cheek lines, also called the nasolabial region, lines as you see here, unwanted lines that occur around the mouth, and the small pits that form right next to the chin. By injecting fat tissue into these areas, desired results can be obtained. So, do we have any information about whether the adipose tissue remains in place? Yes, we have. If it's taken well and stored well, some of the given adipose tissue definitely stays. This sum can be 80%, sometimes 50%. However, we can say that 100% of the given fat never gets absorbed. Well, if a certain part of the fat we give disappears, let's give more fat by considering the part that will be lost, and everything will return to normal when it melts. This is wrong. What if it doesn't melt? What if this time more than necessary adipose tissue remains on the face and an unpleasant image appears? That's why in principle we do as much fat as is needed and we do not do more. If the fats are going to melt, they will definitely melt within 3 months. After 3 months, the possibility of melting the fat gradually decreases. If we give an example, to a person who was given fat previously, if we inject new fat 4 months or 6 months later, there will be a second fat layer added on top of the remaining fat. What are the advantages of adipose tissue? First, this tissue taken from the body itself. It's a substance belonging to the same person, and therefore the probability of undesirable consequences is extremely low. Second, there are special growth factors discovered later in the fat and some tissue-creating substances called stem cells. And these substances show regenerative effects much more important than the volume effect of the fat. And we observed that the quality of the skin, its vitality, and even the color on it change more positively in the areas where the fat is injected. For this reason, I prefer the use of fat or other tissues taken from the patient as a filler material rather than synthetic substances sold in the market.